was 1972. I was registered in Victoria. I trained in a country town in Victoria, but it was a fairly big country town and a long way from other places. So we did lots of different things and there was a big variety in our training. But it was training, you learnt by looking after people. It wasn't evidence-based education. So it's quite different to what it is now. And I'm a huge fan of university training. Because I did the PAP test course through Melbourne Uni, I really enjoyed the course and I enjoyed the way it was taught, but you need to have lots of practical as well. 2004 I started in practice nursing. I was a midwife and I love midwifery. It's the most wonderful job in the world, but shift work and hospitals just are toxic. So I went off to Melbourne Uni and did the PAP test providers course. The GP I worked with offered me a job and I've been here ever since. And I can't believe how much my role has expanded, how much I've learnt in those 7 or 8 years and how wonderful it is. I'm a member of the ANF and I'm also a member of the Australian Practice Nurses Association. I find it really important to be a member of your professional organisations, to read the literature and to attend conferences. I go to lots of conferences and seminars. There are some obstacles in doing further study, whether it's child and family commitments, expenses, work commitments. Most of the time they can be worked around because a lot of the courses are part-time or online. There are scholarships or financial benefits. Sometimes practices will pay for them. So it's really worth it. And if you don't ask, you won't find out. I think I have quite a lot of autonomy in general practice, and I think mostly that's because of the education I've done and the support I've had with my practice and through the people that I work with. I know there's doctors and there's nurses, and I certainly know my scope of practice and I won't exceed that scope of practice. But saying that, the education that I've received has really increased my satisfaction. Hopefully you're working in a general practice that's really supportive, both financially and emotionally, physically, but they will get benefits from that, and they need to see that they will get benefits. You know, when you see that those figures are adding up and people's health's better, or that our vaccination rates have gone up, or that the waiting room's not quite so busy, or the GP's not tied down because someone's coming for a PAP test, where a nurse can quite adequately do a really good sexual health screening and women's health as well as cervical screening. I was a midwife and here I am working with diabetics and elderly people, so education is really the way to go.